Well, it's quite confronting and for remote patients just coming into Royal Darwin Hospital, let alone coming into hospital with a cardiac event. We really need to make sure that the story that we're getting from a patient and then the messages that we're sending to the patient are quite clear and people are understanding.
For the cardiac department, we have about 50% of our patients are Indigenous and most of those are coming from remote regions. If you look at the territory population, they make up between 28 and 30%, so it's actually a significant increase in numbers for the actual population that we're having to look after. My biggest concern for the health of Aboriginal and Torres Strait Islander patients that we're looking after in the territory and elsewhere is the severity of their disease, and that they really are hit by two conditions. One is coronary artery disease. This seems to come on 10 to 15 years younger than the rest of the population, and we don't fully understand why. And the other problem is that of rheumatic heart disease. 90% of the people in Australia who get rheumatic heart disease are Indigenous, and nearly 80% of those people live remotely.
Some of the factors that can really impact on people's stay in hospital is in relation to the being away from home, being away from their community, because when they're in the community, that's what they know, it's a safe environment. Coming into town is very difficult. Our Aboriginal liaison officers play a really important role in making sure that some of the stresses that people may have while they're in hospital are alleviated.
What we're doing in the hospital to support DAMA or discharging against medical advice is making the hospital a more welcoming place for patients, making the area more culturally safe for Aboriginal people. We're looking at engaging with the communities where the people are from to improve the handover of care once the Aboriginal person or Torres Strait Islander person is discharged home. One of the initiatives that we've been doing with the Lighthouse project is improving the use of the interpreting service. For Aboriginal people, English is often their third, fourth or fifth language, so we're just trying to reinforce to our staff that the interpreting service is there to help them as well as the patient, and so we developed some lanyard cards with Aboriginal language and the regions to help nurses and doctors use the interpreting service.
There are a number of positive changes occurring across all 18 hospitals participating in the Lighthouse Hospital project. For example, the Royal Darwin Hospital is building stronger relationships with our Aboriginal medical service. So are all the other 17 hospitals participating in this project. This is helping to assist patient-centred care and continuity of care for Aboriginal and Torres Strait Islander patients. All hospitals are improving the process for identification of Aboriginal and Torres Strait Islander patients and are also working with their staff so they understand the importance of asking whether a person would like to identify as an Aboriginal and Torres Strait Islander person. Hospitals are improving their environment and creating culturally safe spaces for their patients. Hospitals are expanding and supporting their Aboriginal workforce, as well as improving and content of cultural awareness training for their employees.
You need not just to have the project, it needs to transform what we do long term, and those long term transformation requires senior engagement. We're actually about to undertake co-thoracic surgery here at Royal Darwin Hospital potentially next year. And I think it's actually going to be very important that we use this Lighthouse project to not only improve our current services, but establishing a brand new service is a really good opportunity to focus on how we get that right.
There's no one cultural belief that is the best. You know what I mean? We all come from different cultures and different backgrounds, and it's about understanding that and about making yourself aware of the different aspects to different groups of people.